So I'm really excited to be here. Thanks, Steve and Katie, for all the hard work putting this together. And I'm sure I speak with some of you that it's really nice to hear other people talking the same language. Normally I go to these kinds of conferences and everyone's like, private wells, what is that? So it's actually nice to just be like, oh, I learned something. So absolutely. So I coordinate a statewide program with Virginia Cooperative Extension, which is part of Virginia Tech. Kelsey spoke with you earlier. She's one of our lovely graduate students who finished and is doing wonderful things with private wells. We're really proud of her. In Virginia, about 1 in 5 of us rely on private water supplies, and I'm including wells, springs, and cisterns. And that's pretty much backed out from who we think is on public water supplies. It's not that well documented. This is a nice study that came out in 2010 that documented overall waterborne illnesses are decreasing in the United States, but there's a relative increase in private water supply and associated illnesses. And as we all know, this is hard to track because they're private water supplies and you don't have to test them and you don't have to turn in the information in a lot of times. So it's a relatively little understood problem. We know that homeowners who rely on these systems are responsible for all aspects of managing them, but often lack access to resources and are not equipped to make decisions about taking care of their water quality. And a lot of times they wait until something drastic happens before they do anything, right? Till the water turns brown, the pump goes out, something like that. So that's really the function of our program. We have the most amazing acronym of all time. And I want you guys to say it with me. VHAQUAPA. All right, Kelsey's really embraced VHAQUAPA. She talks about it all the time. Everyone thinks she's as insane as I am. The program was originally started in 1989, so it goes back a little ways. The way that the program works primarily is through what we call county-based drinking water clinics. So some of the other programs you've heard discussed, like Penn State, Texas has a similar program, Mississippi State is getting one started. These are similar efforts, okay? So county-based programs. We have decided to tweak the model a little bit. So when the program first started, it was heavily dependent on one extension specialist who would travel around the state and be the expert that would come and conduct the meeting, answer people's questions. What we've done is really build capacity by training local extension agents to support us in the program. So that's been amazingly powerful. They become recognized as local experts. They're available year-round to talk to clients that they already have contacts with. It's fantastic. The model is working really well. The program is relatively affordable. I'll talk about that in a minute, and it's confidential. The homeowners do collect their own samples. We, basically the way it works is that we advertise a schedule with a sample collection day. We do those on Wednesdays. We have one most weeks of the year. Everyone comes to a meeting, gets their water test kit, and learns how to collect a sample, goes home. They all collect them at the same time on Wednesday morning and drop them off locally, and we coordinate moving all that water and ice and coolers down to Virginia Tech for analysis. We work with 2 different departments and labs on campus. So one is Biological Systems Engineering, which is where I'm housed. And we also have the pleasure of working with the Flint Lab, which is Mark Edwards and Kelsey's group over in Civil Engineering. So they do all of our metals and mineral analysis. The value-added part of this program is that once we've sucked everyone in and gotten them to give us their water, we have locally what's called an interpretation meeting. So the participants come back. Our data shows that about 75 to 80% of them come back for the results meeting. They get their results, they are looking at them while they listen to a presentation that's catered towards their water quality, that county's data. And as we know, a lot of water quality is driven by geology, so we can say a lot about what's going on with water just based on where you're from. And so we build on that and then talk about the nuances of what's going on with your treatment, your plumbing, things like that, and really paint a picture of what's very personal information for those participants. We hold these programs in about 60 counties every year. Virginia has 96 counties, in case you just didn't know that off the top of your head. So we've built this up using this capacity of the trained extension agents in order to do this across a lot of the state every year. The data generated so far, we're looking at about 23,000 samples from almost every county in Virginia. So we have a couple holdouts who still, refuse to participate, but we're working on them. We're wearing them down. This is what we test for. It's a pretty lengthy list. And we are able to do this right now. Our cost in 2017 is $55 per sample kit, okay, which is pretty reasonable. It's still a stretch for a lot of counties in Virginia. In Virginia, we have the unique situation of having literally some of the wealthiest counties in the country and some of the poorest counties in the country down in the coal fields. So in a lot of cases, this is expensive for participants. So we have mechanisms to get donations or grants to help offset that cost for people if it's a little pricey. Now, the analysis is done through research labs. Ours, which is what you see in the picture, that's our lovely lab manager, Kelly Peeler, and through Mark Edwards' lab. These are not state-certified labs, so we're very careful to talk about this being just for your information. It's a screening, it's education, okay? So it's not, to be used for other purposes necessarily. We also only process our samples in batches. That's why we coordinate the whole calendar so the samples all come in from a given few counties each Wednesday. We don't handle one-off samples like some of the other labs that you've heard from today. We also have a Virginia well owner network. We totally stole this idea from Penn State. 100%. We actually wrote into our first grant that allowed us to start building the capacity for our program time for Stephanie Clemens, who was working for Brian Swistock at the time, to mentor me. And that was one of the smartest things that my supervisor did, where he actually paid her for some of her time so that she could help get our program started. That was really powerful. There are other programs similar to this one that have popped up around the country now. Jason and Drew and Diane are going to be talking about some of those. I benefit from learning about how they're doing things and vice versa. It's a great network. Extension is amazing because we all share resources and adapt each other's stuff with permission. So it's really valuable to have that network. So this is what we call our mechanism for training the extension agents. So we offer day-long workshops across the state. We have extension agents come, and we do have a small volunteer network. Now, something we've learned in Virginia is that our volunteers are not nearly as powerful as our extension agents. So they tend to come, they soak up all the information, and we don't hear from 9 out of 10 of them. Again, they're like, thanks, that was great, thanks for lunch. And then they disappear into the sunset. So we still have a few volunteers, some of them are great, but we have focused our effort more on training the extension agents and what we call agency collaborators. So these are employees of Department of Health and Department of Environmental Quality in Virginia. The more they know about our program and are sending people to us, the better. And we end up working together very well. So they come to our trainings as well, and they get to know their local extension agents too. So these are one-day training workshops, as I mentioned. They vary regionally across the state. We have guest speakers from drilling companies and all these state agencies that help pass along this information. And these are the topics that we cover. So groundwater basics, well construction and location and the regulations associated with wells in Virginia, land use impacts and wellhead protection, water testing, interpretation, and then solving problems and treatment. Okay, it's a lot to pack into an 8-hour day. Just a little bit about how the program has evolved over the years. So I mentioned when it started, it was heavily dependent on one extension specialist, and that was a limitation because we could only get to so many places. So when he retired, the program really died for a few years. My supervisor, Brian Benham, wrote a USDA grant that was funded in 2007 that allowed us to kick off this new model, which involved hiring a coordinator. I always tell Brian, for better or for worse, he got me. And I literally called him and was like, I think you should hire me for this job. And he was like, I haven't advertised it yet. And I was like, that's okay, don't worry. So it's worked out now for 9 years. So we hired a coordinator. We benefited from mentoring from Penn State and really got the program up and running again, started training the extension agents. In 2011, we got a second USDA grant, which was Rural Health and Safety Education. And that was through another PI in our department, Leanne Cremidas. That allowed us to add additional contaminants, subsidize testing for low-income areas in Virginia, and kick off our research efforts, which included Kelsey's work. Okay, so that was really powerful. So those two transfusions of funding helped us get the program up and running. Since 2013, when we used up all that grant money, we've made the program relatively self-sustaining. So we've proven that the program is effective enough and useful enough that my position is hard funded through cooperative extension, and the money that we charge per sample kit pays for the rest of the operating costs for the program. That's a model that we're being pushed towards more and more with extension because budgets keep getting cut. So we're hoping that that's going to keep us floating and keep us viable. We just have to keep bringing people in the door. Bad things happen to this little pie chart. It's going to be okay, though. This is just some data, so a snapshot of the systems that we're analyzing. You can see about 72, this is homeowner reported, and as we've covered several times, homeowners don't know what they're talking about a lot of times. So we'll take all of this with a grain of salt, right? So 72% of people think they have a drilled well, 12% think they have a dug or bored well, 10% think they have a well, period, maybe. Not so sure. That number's actually come down over the years. We're impressed that more and more people know they have a well. About 4% are springs, and about 1% are cisterns, okay? Wells that come through our program, and these are like the brownies of well owners, right? They're the nerds that come and show up to the program and get their water tested. The wells are an average of 25 years old, okay, which is getting very close to when the well regs came into effect in Virginia. So we know these wells are older, and some of them, quite a few of them, were constructed before there were well construction regulations. 80% of participants have tested once or never. This number, we ask every year on the questionnaires, it stays consistent. Okay, so one, it's good because it means that we're getting new people in who still say, I've never tested before, but it's shocking that so few people are testing outside of our program. As far as type of treatment device, I'm gonna show you what we see in the water on the next slide, so keep this in mind. Not surprisingly, the reason people test their water is because of aesthetic contaminants, and the reason they treat their water is because of aesthetic contaminants, right? We know that. So 47% have no treatment, they think, right? Let me go back to that again, because that's what we think. 30% of a sediment filter, then you can see softener, iron removal. We don't get down into treatment devices that can remove health contaminants until we're looking at 3% of well owners, okay? So people generally are not removing those contaminants from the water supplies, okay? This is, from the last slide too, this is about 8 years worth of data, 9 years worth of data. Okay, so using the EPA standards as guidelines, this is what we see in terms of exceedances. And so when we talk about something falling outside of the recommended range, the blue bars are aesthetic contaminants, so you can see the percents that are falling outside of what's recommended for wells, and then the red bars are health contaminants. So we see about 40% are positive for total coliform, quite a bit of sodium. On the eastern side of Virginia, that's because it's the coastal plain. On the western side of Virginia, that's because everyone's removing hardness and adding salts to their water. And then they're alarmed when there's salt in their water. And they're like, where is it coming from? And I'm like, do you put big bags of salts in a thing in your basement? They're like, yes, I do. I'm like, that's what's happening. Okay. A lot of lead and copper in the first draws. Again, that's very, like Kelsey talked about, it's heavily related to geology, okay? So we can predict where there's gonna be higher lead in the center part of Virginia, the Piedmont and the Blue Ridge, and when we have shallower wells, okay? Just the water tends to be more corrosive. A little bit of nitrate, just for flavor. Fair amount of E. coli, it's about 8 to 10% in our samples. And a little bit of arsenic, not nearly as much. It's actually 0.5%, I believe. I will point out these are almost all tap water samples, okay? And they're homeowner collected. So they are not perfectly collected, but this is the water people are drinking, That's what we've come up with. So it's not groundwater, it's tap water, and that's what we talk about when we do the presentations. So, extension is big on documenting impact, which involves thinking about evaluation and whether or not you know your program is working at the outset. So we ask participants right after they participate what they plan to do in the next year, okay? The blue bars that you can see, the shorter ones, that's the percent of people that say they will take each of these actions. So pump the septic tank, seek more testing, shot chlorinate, et cetera. We did a follow-up study about 2 years after after we asked all these folks these questions, and the green bars are what they report actually doing, okay? So this is good. We've only done it once, so we don't believe it yet. But right now, we think it looks like people are acting. So based on these results, including the follow-up survey, 70% took some action, 64% took more than one action. In this result, action exceeded intent to act, which is exciting, and we will follow up probably next year. What was interesting is that we did try to find if there were significant differences between the type of action based on your results, okay? So if I tell you you have E. coli, or I tell you you have low pH, you should do different things, right? No difference, okay? So interestingly, we don't know what's going on there yet. We'll look a little deeper into that to find out if people are really understanding and acting based on their results, or just saying, generally speaking, it's probably a good idea if I pump out my septic tank. And that's not a bad thing, right? Okay, so we were bringing all these people into programs, giving them their water test results, and then giving them a bunch of information about well maintenance and water treatment, and people needed the next step, okay? So in 2012, we partnered with our Well Drillers Association in Virginia, and I know the next speaker is talking about partnerships, and our partnerships are the reason that our program works. The well drillers, when I started in 2008, were not happy with our program because generally speaking, the way the media would cover a program in a county was, oh my God, these wells are a disaster and it's the well drillers' fault, they're drilling bad wells and everyone's well has bacteria. And so it took a lot of building of this relationship to bring it back to where they could be partners and be sharing in our messaging and helping inform what we included in our resources. So we started this partnership with them. We developed, with their help, an inspection checklist and had a little funding to provide printouts of this inspection checklist for them to use so that homeowners, after participating in a program, could look up a local driller, call and say, hey, can you come check my well? And it's a legible, easy to understand document where they can say, I know I need to do X, Y, and Z. Okay, so the coverage of the map is the contractors that we have signed up so far. Well drillers are not a quick to change group necessarily. So we're keeping on plugging at having them sign up and use these documents. And it's working well in some counties, but it's going to take a while to get the whole state covered. This effort is also pointing to the fact that, like a lot of places in the country, we are beginning to see areas where there are no service providers, where there are not well drillers anymore, because people are going out of business, the population's leaving the area, and that's going to be a real issue for well owners if they can't get help if they need it. Our hope for Well Check is that it'll be covered across the state, that homeowners will see wells as an important system in their home that needs care and maintenance, and that routine well inspections, I don't care if you do it every year or every 10 years, just once in a while, when you hit your well with your truck, have someone come look at it, give it some love, right? We hope that this also is an opportunity for contractors to keep in touch with their clientele and generate more income, because that's a plus for the homeowner and the drillers. We also would like this to become part of a real estate transaction. The realtors are first in line to be like, oh no, we're not giving you one more reason to slow down our transactions, right? So I have been doing more training and outreach with them, so we'll see if that happens or not. I mentioned our partnership with the Well Drillers Association. That's been huge. They are amazing guest speakers. We saw some great examples of that yesterday. They're passionate about what they do. They know more than any of us about the geology and the well construction in the area. They've been amazing. We rely heavily on USGS, Department of Health, and Department of Environmental Quality for guest speakers and for just additional information. We work closely with RCAP, with Janice and her crew up in Roanoke. They've been great as partners on grant-funded projects and in providing funding when we have limited resource folks needing to test their water or improve their wells. We also, over the years, have built up a nice list of research collaborators. So using parts of our data that's been stripped of contact information, they are able to dig a little deeper and ask questions that, frankly, I don't have time to ask or the expertise to ask. So we've done some bacteria source tracking, metals and lead profiling, Kelsey's work that she presented yesterday. We just wrapped up an arsenic risk model, and Virginia has a very small amount of arsenic, actually. So it's kind of a boring looking little map. It's just like a couple blue dots. So I don't know. It's good news, I guess, right? We just started a project with some folks also at Virginia Tech looking at emerging contaminants, so pharmaceuticals and ingredients in personal care products. We did a screening of 10 wells in a rural county in Virginia, and we found at least 2 compounds in every well, and most of them were antibiotics. So we are doing additional research to take more samples and characterize those contaminants, but it's pretty disturbing, really, that it's there. We also have a youth effort. We just really love Penn State. We have to do everything that they do. We piloted this with 2 high schools. We got a lovely donation from CERCAP to help cover the cost of analysis. We worked with 9th graders and 11th graders. We got parental consent for them to test their well water. The students collected their samples and came to campus. And we have a beautiful new building. Our lab is amazing. We were in the basement of a really gross building for a long time, so we definitely earned it. But they come to the lab. We walk them through activities. They actually get to see what we do in the lab. We have guest speakers come and talk to them about drilling and things like that. Then we tell the kids about the results in aggregate. We don't say, ew, Johnny has E. coli in his water. Everyone look at Johnny. We don't do that. The students learn the basic information, the aggregate results, and then they alone do the presentation to the parents, and the parents pass the post-test. Like, it's super exciting. And it's relatively technical information. The science teachers get super excited because they're like, they didn't know what pH was before, and now they understand why it matters in this situation. So it's really exciting. I love kids, so we do lots of other outreach on campus through summer camps and fairs and things like that. So we have groundwater models. Anytime we can get with them, we go for it. And we also work with 4-H. Basically, our whole program is just based on helping people understand where their water is coming from and how it got the way it is, and we can provide this very real-time data showing, whether they have surface water contamination or whether they have metals or something else that's going on with their water that's coming from inside the house, like a horror movie. And so we're just trying to help them be more empowered users of wells, more empowered consumers of things like water treatment, so they know what questions to ask, and they're just better informed when they go out into the marketplace to make decisions about purchasing these things. Generally speaking, in terms of running a program like this, seeking initial funding to kick off a program and build capacity is a great way to do it if you can. We have definitely benefited from modeling after successful programs around the state and the country and seeking mentors. Partnerships are key. So anyone that you're gonna, bump up against when you're doing this kind of work, definitely engage them and figure out how you can work together and not duplicate efforts. That's huge. I like to think a lot about collective impact. So how do we work together so that we're not stepping on each other? One thing that I know has been a real challenge for some of the other folks that we've worked with who've been trying to do this kind of program is that having a lab facility is key. So if you have access to a research lab where you can do the analysis for a reasonably cheap price, that's huge. I have colleagues in Maryland, for example, who've been trying to do this kind of program for years. The best they can get is $150 worth of analysis through a private lab, and it's just not, it's not working at the moment. So being able to have access to lab and quality staff is essential. Diversifying methods to reach different audiences, so adapting to have a youth program or reach lower income folks in a different way if they're not going to be able to participate in the standard way. Building in research efforts to really do exactly what extension is supposed to do, which is asking the right questions and then improving your recommendations based on what the research is telling you. That's exactly how it's supposed to work, and they work better together than alone. Evaluation is huge. I think a lot about evaluation in terms of the type of thing I want to be able to say about my program. That's how I figure out what questions to ask people. So I'm always thinking about that. I really have appreciated Barb's work with this because it's huge when you think about barriers and benefits and what's in the way of people doing what you want them to do. And then finally, just figure out, there's a lot going on out there. It's hard to get your head up above the crowd when you're when you have a message. So just be creative and think about, making your information templated so that other people can adapt it and use it across the state and other places with other programs. So, thanks. That was fun.
Questions?
Hi.
We got to visit her lab. Katie and I did. It was great.
It was awesome.
Brand new building.
Yeah, it's
gorgeous.
so pretty.
I'm jealous.
We're very lucky.
My name is Andrea Alberton, and I come from the University of Florida, and we're looking to start a well owner
I've
network.
heard about you.
Probably from Diane.
Everyone says you're amazing.
Oh, no.
Hi.
No, Diane invited me to the conference, and I'm so
Oh,
glad I
good, yeah.
My question had to do with the agents, because right now we're 5 people in my position, and 2 of us are interested in this, and I need to be able to recruit agents in my region to do it. And we have, of course, ag agents and 4-H agents. And how did you do that? And because they're so busy already.
They are.
So I was wondering how you recruit them to your program and how they then, because the counties tell them they want something to do.
Yeah. So it's a combination of things. One is that when I started as the coordinator, the program was recognized as only an ag program. It was a farmer kind of program.
Okay.
And so I immediately flipped that and was like, yeah, but it's also a family and consumer sciences program.
Okay.
We're talking about health, we're talking about home safety. So I was willing to work with anyone. So that's the first thing. Then figure out who's already doing something that's close to this, right? So if someone's already doing radon testing or lead education or something or youth water education, somewhere where there's something already happening that they're already bought into that's working for them, then say, oh, can we do it this way? Be flexible is a huge one. Just to find the willing people, work really hard to make it successful, and then toot your own horn to say, look at this, look at how it works. I spend a lot of time talking to administrators and to county level folks to say, how will this be an attractive program for you? Is this something you value? Why do you value it? How do you think it should be done? So people see themselves in your success. That's the way I think about it.
Sounds great. Thank you.
Tom?
Hi, Erin. I'm Tom Christophers from the state of Nebraska.
Nice to meet you.
Nice picture.
Oh, thank you. It was, the photographers came and they said, can you do something glowy? And I said,
You're glowy.
sure. E. coli.
I got a question. A couple of times you referred to using the homeowners, not being a reliable source
Of information.
of information. How do you keep that data sequestered so it doesn't get into somebody's database and it says, and kind of like when you referred to the drillers were upset about your program, can you talk about how you address that, how you
Sure.
kind of took care of that?
So with the homeowner side of it and protecting confidentiality, we do have an IRB, Institutional Review Board protocol that we follow to protect the data. So anytime the data is presented in public, it's presented in aggregate, usually at the county level. We've gone as fine as the zip code level, but that can get a little weird. So we're just really careful. We don't do mapping with our data right now, even though that would be really valuable to protect those individual homeowners and their information. So we do take a lot of steps, and we make that promise to people that we'll keep it confidential. In terms of building the relationship with the drillers, it really just came with finding a couple drillers that understood the importance of the program, and then using them as experts to say, how can you help us improve recommendations? We need your information, we need your input. Really, they're key to the program's success. So it was really just about engaging them in a way that they didn't feel like it was us and them. Does that make sense?
Well, yeah, kind of. That makes perfect sense. But what I was getting at, you said you had like a 22% E. coli or some.
It's 10%.
Or 10%.
Yeah, 10%. Mm-hmm.
Is there any concern that some of those could be sample related?
It's possible. I would say that's more likely with total coliform. We did some in-lab trials to try to contaminate samples, and it was a little bit harder than we thought with E. coli.
Okay.
But we are very honest when we talk about the data to say it's homeowner-collected tap water samples. There is a risk of cross-contamination, that kind of thing. You know, we're very careful to never have this be represented as groundwater data, for example.
Okay.
We have had a couple situations where we have a waiver where some other entity would like access to more of the data. And if we do that, we have another consent form that the homeowner will fill out that says, I give so-and-so permission to have access to this amount of my data. So we've done that with like a couple groundwater monitoring committees around the state.
Thanks.
Yeah.
All right,
All right,
you.
thank you.